Hi and welcome. So we're gonna be looking at clinical clerkship in pediatrics. We're gonna be looking at the overview for basic clinical knowledge as well as for examination purposes. So clinical clerkship in pediatrics is the period during medical training where students learn to evaluate, diagnose, and manage diseases in newborns, infants, children, and adolescents. It focuses on developing skills in history taking, physical examination, communication with children and caregivers, and understanding pediatric emergencies. The objectives of pediatric clerkship are to develop age appropriate history taking skills, perform a complete pediatric physical examination, recognize common childhood illnesses, understand growth and developmental milestones, learn vaccination schedules and preventive care, manage common pediatric conditions using standard guidelines, learn communication with parents/caregivers, understand basis of pediatric emergencies, apply principles of nutrition, breastfeeding, and neonatal care. So, what are the core areas you must master in pediatric clerkship? First is history taking in children. Pediatric history is different from adult history. It must include presenting complaint, history of presenting illness, birth/neonatal history, that's the ABGA, the birth weight, and complications. Feeding history, immunization history, developmental history, that's the gross motor, fine motor, speech, and social history, all are part of the developmental history. Past medical and surgical history, drug history, family, and social history. So, what should you know about pediatric physical examination? You should always look at the general appearance of the child. That's the child's activity, alertness, and hydration. You look at the anthropometry, that's the weight, the height/length, the head circumference, and the mid upper arm circumference. You look at the vital signs, age specific heart rate, respiratory rate, and temperature. You look at the systemic exam, you do respiratory, cardiovascular, abdomen, neurological, and you look at the ear, the nose, and the throat, that's the upper airway. Look for danger signs such as lethargy, cyanosis, grunting, severe dehydration, and seizures. So, about the growth and development, you must know milestones for each age and you should notice the red flags such as loss of milestones, not sitting by 9 months, not walking by 18 months, speech delay. You should be able to read growth charts and also be able to plot them yourself. And you should also know the immunization schedule such as birth vaccines, which include BCG, oral polio vaccine, 0 hepatitis B, at 6, 10, 14 weeks. You should know OPV, Penta, PCV, that's pneumococcal conjugate vaccine, Rota, depending on your country. So at 9 months, you should know that it's measles, yellow fever vaccine. Then vitamin A schedule, you should be able to create a catch-up schedule for missed vaccines. So at the nutrition and feeding, you should be looking out for things like exclusive breastfeeding for 6 months, complementary feeding from 6 months, signs of malnutrition, management of severe acute malnutrition and moderate acute malnutrition. So, what are the common conditions you should know in pediatric clerkship? You should be able to understand and identify pneumonia, diarrhea and dehydration, malaria, neonatal sepsis, fever in children, asthma, anemia in children, seizures and febrile convulsions, congenital abnormalities, common neonatal issues such as jaundice, hypoxemia, and feeding problems. So, what are the practical skills you must learn in pediatric clerkship? First is plotting growth charts, oral rehydration therapy, preparing IV fluids in children, neonatal resuscitation, drug dosage calculation, intraosseous access basis, lumbar puncture indications, and giving vaccines safely. So, what is ward work during pediatric clerkship? What is expected? First, you should be able to clerk new patients, present cases during ward rounds, assist in procedures, monitor vital signs and hydration status, write fluid charts, medication charts, attend clinics, as immunization, neonatal and sick children clinic, participate in core duties. So what's the assessment during clerkship? You do long cases / short cases, OSC stations, daily ward evaluations, logbook completion, written tests or presentations. So what are the tips to excel in pediatrics rotation? Always be gentle and friendly. Children respond to calmness. Speak to caregivers with empathy. Always calculate drug dosage by weight. No danger signs. They impress examiners a lot. Plot growth charts during presentations. Always ask about immunization and feeding history. Revise common emergency protocols. Keep a small handbook in your pocket. Practice as many physical examinations as you can. Thanks for listening, and do not forget to like and subscribe if you found this video helpful.